Emma, 60-year-old female, came with complaints of bleeding per vagina since 2 months for 5 to 7 days. She's using 3 to 4 pads per day, no history of passage of clots, white discharge per vagina, pain abdomen or mass per abdomen. There's no history of loss of appetite, weight loss, no history of trauma or intake of hormone replacement therapy, or no comorbidities known. Her LMP was 5 years ago. On examination, general physical examination is normal, systemic examination is normal. Local examination, vulva appears to be normal, per speculum, vagina is normal, and cervix is normal. So, how to approach a postmenopausal bleeding? So, it is discussed under three headings: definition, causes, and evaluation. So, the definition is vaginal bleed from the genital tract after 12 months of amenorrhea in a menopausal age group. So Emma was 60 years old. Her LMP was 5 years ago, presents with bleeding per vagina. So she fits under this definition. So there are various causes for postmenopausal bleeding, and to simplify, it is divided into the female genital parts. So we have a vulva, vagina, cervix, uterus, and ovary. In vulva, it could be due to trauma, carcinoma, benign lesions. In vagina, it could be due to atrophic or senile vaginitis, which is common, foreign body, or carcinoma. Cervix, cervical cancer, or cervicitis. So the uterus is the important one. So the most common postmenopausal bleeding is the atrophic endometritis overall. So when a female postmenopausal age group comes with bleeding per vagina, so first differentials should be atrophic endometritis. So other, it could be carcinoma, polyp, or hormone replacement therapy, or on tamoxifen. Ovary, it could be carcinoma of ovary, either theca cell or granulosa cell. So how do you evaluate? So first you take a proper history and then do a examination. So history, it could contain her LMP, the duration, the number of pads, passage of clots, any white discharge, or loss of appetite, or weight loss. So to rule out malignancy, any mass per abdomen. So to rule out any growth or tumor growth, either ovarian or uterus. And examination, so you have to do with the general physical examination. So you have to start with the GPE. Why GPE? Because of bleeding, there could be anemia. There could be signs of anemia can be elicited. So the pallor, platinacea, cholinergia, and because of hemorrhage, there could be a hemorrhagic shock, hypovolemic shock. So there could be hypertension, and systemic examination has to be done, so per abdomen, to rule out any mass per abdomen. And next we have to go with the local examination. So under local examination, you see the vulva, so any trauma to the vulva or any lesion over the vulva, and then you do a per speculum examination. So you examine the vagina using a sim speculum, so that all the four walls are being examined. In a Cusco speculum, the four walls cannot be examined. So you examine the vagina, you examine the cervix. If there is any growth on the cervix, you take a biopsy. If not, then you take a pap smear and TVS. In TVS, you see the endometrial thickness, that is a transvaginal sonography. You see a endometrial thickness. If more than 4 mm, then you take a biopsy. If less than 4 mm, then the diagnosis would be atrophic endometritis, after ruling out other causes. If the recurrence occurs, if the patient comes back with a similar complaints, then you do a biopsy and you see the histopathological slide.